And now we are in session 3 and perspective of radiology by Dr. Nasia Papachristodoulou. We are happy that she is with us here in this webinar. She is a clinical governance lead in Affidea, the headquarters in Budapest, Hungary. She is a chief radiologist with main interest in dose excellence program. She is experienced in oncology, vascular, and pulmonary cross-sectional imaging. Also, she works in patient safety, risk assessment, and audit skills. She has multi-country work and multi-country clinical governance, operational and business development experience. Welcome, Dr. Nasia, for your session, Perspective of Radiology. Please go ahead and share your screen. Thank you very much.
Salam alaikum. Good afternoon, everybody. Thank you so much.
Wa alaikum assalam.
Thank you so much. I would like, first of all, to thank the organizers of this very nice session, of this webinar, organized with the opportunity of the International Day of Radiology. Having this in mind, I would like my presentation to be a kind of celebration and to say well done to everybody that has been working all this year in this magnificent field of radiology, all the medical physicists, the radiographers, the radiologists that have dedicated their life work in this amazing topic, where we have been and where we are today. So just a short outline, we are going to begin with the journey of radiology, as I said, in time, where we are now and what we are doing at the field, the radiologists, the radiographers, and the medical physicists on the field, and also what the close future is bringing for us and how we can adjust and be ready for it. First of all, a very general and very homemade, let's say, definition of radiology. Radiology is a science that uses radiation, X-ray or other, especially the use of this radiation for the diagnosis, but also for treatment of disease, using very complicated and dangerous equipment. This is a short version of what radiology is. As Dr. Ozan said earlier, all this adventure began on the 19th century. We all know this very famous guy to whom we thank every day, and all the new achievements that radiology has had over the years. What is read here is the digital version of the achievements. There is no need to go through all of them. We will see them in the next slides. Through all the years, the radiographer and the radiologist have been working together. So this is how it started. It used to be kind of weird, let's say. A radiographer and radiologist were doing something that people couldn't understand, dangerous for some reason. So people working in a radiology department usually were the weird guys, let's say. This, of course, changed now. And through all these years, you all, of course, know this is the first X-ray ever taken. And Röntgen was clever enough to make an X-ray of the hand of his wife and not himself. And from this picture, through over the years, we ended up into here and actually in much better quality images. Now the equipment, as I said earlier, it's very complicated, it's very high-tech, it's very weird. The images are very detailed, very nice and to the point with colors. And actually we are achieving the functional level of the tissue, not only the imaging. In the last 3 decades, there have been advantages in biomedical imaging, in genetics, molecular biology, engineering, information technology. All these have made a huge change in radiology. Now radiology is an interdisciplinary science, let's say. It is a part of a big family of sciences. Through the last 3 decades, among the medical innovations that took place, 3 of the top 5 are directly related to imaging advances. And this is magnetic resonance imaging, through the last 3 decades, imagine, computer tomography, of course, balloon angioplasty, and mammography. I'm sorry. Okay, so where we are today. We have really nice, very fancy images we can show off to our clinicians, to our colleagues. But it's not only that. Conventional radiology, somebody would say that there is nothing new in conventional radiology, but still we have tomosynthesis. And as we all know, the lesion can be more easily identified and actually help also to the therapy, to the intervention that is performed by our colleagues. Ultrasound. It has been developed during the last, let's say, for 4 decades. Now, ultrasound, I would say that it has a dual approach. It is democratic on one hand, but also aristocratic on the other. Democratic because it's accessible, easy accessible. The machines are smaller, very good, easy to manage, easy to handle. They can have the size of a smartphone or even be connected to our smartphone. Also the fast examination for trauma patients in the intensive, in the emergency departments, in the hospitals. Ultrasound is democratic, is accessible, and it's present everywhere. On the other hand, it's also aristocratic. We have very fancy new techniques, the 4D, the elastography. We cannot say that ultrasound gave all that was there to give. It has made some developments during the past years too. Computer tomography. As you can see in this video, the speed of the computer tomography is amazing now. And we can all thank God that there is that the machine is turning around and not the table with the patient on it. The volume of the data and the information that can be achieved by the computer tomography is immense. This data and this volume is quantified. The resolution of the new machines is amazing. We have dual source or energy. We have spectral CT with multiple applications in our everyday life as of now. Cardiovascular imaging, it has been improved enormously during the last year with the help of the new CT equipment. Perfusion imaging. Now we are not only able to see, to identify the lesion, but also we are able to study how this lesion behaves. We can actually go to the tissue level and study the tissue and how it behaves. Virtual endoscopy, of course, we all know, another achievement of the computer tomography during the last years. Quick, easy, and way more easy to do for the patient. Magnetic resonance imaging, of course, the field strength has been increased, has been changed enormously. Now we are talking about 7 Tesla or even more. MRI magnetic field strength. The structure and the composition has changed, but also the function. We have new applications of the MRI imaging. DTI, amazing images. We can see the neurons, the tracts, and how first of all, how they function, but also in case of a lesion, what is exactly the problem in the brain, in the neural attractions, and how it can be resolved. MR-Spectroscopy to study the metabolic behavior of the tissue. This leads us easier to a diagnosis, but also facilitates the management of the disease without compromising, of course, the patient's safety. Functional MRI, this is fantastic, this is amazing. We can understand how the brain works. Unfortunately, we are not able still to know what's in a woman's mind, but we can understand the brain better. And of course, there is a big road ahead of us to become even better. This is just something to cheer up a little bit, but the users of the functional MRI can achieve the study of the brain in territories that are not, they could not be been even imaginable some time ago. Informatics, the huge development of radiology is based also on the development of the informatics, of course. We have the automatic segmentation, which leads to the detection, as the other speakers said, presented before me. Clinical decision support system that can support the clinicians to decide and to order the correct examination according to different parameters of the patient. Structured reporting, very important in the radiology, which give us a big database, as we said earlier. By Dr. Rosanne, PACS and electronic medical record. This is something that has been developed by informatics during the last years. And teleradiology, which is, in my opinion, gave a big explosion, a big change into the way we are all working. CAD. Today is used for detection. Maybe tomorrow it can be used directly for diagnostic. Cloud-based image sharing network, rapid computation for data mining and decision support, and electronic management tools. These are all are tools that are coming, they have come already and can lead us to the future, and which lead us also to the artificial intelligence. Artificial intelligence, if we think about it on a department level, on a radiology department level, it's not only about support on the radiology, support on the finding the lesions, or a second opinion. The benefits are multiple, from ordering the examination and scheduling the examinations according to what and when we can do it, coding the examinations, billing, how to select the correct protocol and the correct parameters specialized for this particular condition of the patient. Also for the realization and interpretation of examination, reporting of the findings, and also what happens afterwards, how to deliver the results, and different services after our examination. Everything leads in what is now known as integrated diagnosis. It's a merge of all the information, of all the data from clinical, from laboratory, for imaging, whatever this image is, and pathologic tests and examinations. Everything is integrated, and we have a diagnosis for this patient. According to this data, we plan what to do, how to proceed, how to manage the disease or the condition of the patient. We go to therapy, follow up. If a new lesion is found, this goes on again. So we are talking about a circle of integrated diagnostics. We are talking about a one-step healthcare, as it might be known. Everything leads also to electronic medical records, again, because of the huge improvement of informatics also. And we can have something like a tablet, let's say, with all the information of the patient, all the examinations that have been performed, the physical notes by the physician, the laboratory test, the imaging, everything in there. We don't have to see the doctor going in the hospital room with the nurse, with all the files, with her, trying to find all the paperwork and what the patient has been done. But we have everything in one tablet. Actually, it can be maybe connected with GPS. So when the doctor is going to one particular patient, the system recognizes exactly where the patient is and what can be done for his condition. Possible trends of development in the future, we are going deeper. We are going on molecular level now, guys. We go to a cell or to disease specific, and we connect the diagnosis with the treatment. Diagnosis is made on a cellular or disease level, and so the treatment. We don't have to compromise the health of the patient, the whole body, but we got targeted on the lesion and we are fighting it. Multiparametric imaging, there are many fields of development also here. Histology now can be done in vivo, and mass computing, automatic analysis or diagnosis of any lesion at any level. And as we said earlier, automatic image or guided, automatic image guided treatment, which can be used for therapeutic reasons, mainly for radiation or surgical intervention. All these trends of development, let's have a moment here to see how amazing we are. We are working in the best field, and this is my honest opinion, in the best field of science. We have come a long way in a very short period of time, but we adjusted. And the future is coming closer. All these developments and what is also very close to come leads into a fast, personalized, easy generated and interpretable information. Information is the power, and this leads in shorter and cheaper way for diagnosis and therapy of our patient. Just to close up with a very well-known saying, the future is not something we enter. It's not a door we open and enter in the future. The future is something we create. And the future in radiology, may I add, is amazing. And saying this, I would like to thank you all for your attention.
Thank you very much, Dr. Nasia. Thank you very much for the informative session. Is there anyone has a question? I see there are comments throughout your presentation.
I have a question, if the moderator allows me.
Yes, please,
Thank
Dr.
you, Dr.
Ozan, go
Nasia.
ahead.
It was really a fantastic presentation. My question about, actually, I mentioned in my presentation. So regarding to data gathering, what is the recent European regulation rules in a certain country? So one is able to gather this data from a hospital, or is, as far as I know, the European regulations are very strict in this case. So how do you managing this issue actually for gathering for the legal permissions from the ministries, or is there any uniform bylaws announced by the European Union? So
thank you so much, Dr. Ozan. This is a very nice question, and to be honest, there have been a lot of discussions during the last years. I am working in a multi-national company with diagnostics and outpatient services, mostly situated in European countries, 16 European countries. So there are European directives about how to manage the data. Data is enormously, as you also said in your very nice presentation, and data is power in our days. So there we have to protect the data. So individually also countries have developed their country regulation in order to do so. It all begins with the patient, of course. Consent forms have been changed now. We have to have the patient concerned even if we want to use anonymously the data or whatever he or she provides for scientific or whatever reason. I'm sorry. But also for example, we cannot go to a hospital and just kindly ask for the data to be shared. It is very difficult, and the regulation is very strict. It's becoming stricter, and actually it makes it very difficult, if not impossible, to share. I hope I answered your question.
Thank you so much. Yeah.
My pleasure.
Thank you so much, Dr. Nasia.